Well, hello everybody, and thank you very much for attending and tuning in. And when I say everybody, there are a lot of everybody's, over 1,300 people registered for this webinar. So thank you all very, very much. Um, the original intent of these expert panel webinars, for those of you who are just joining us, is that I wanted people to be able to hear from the folks who had to make the tough decisions about things like what we're going to talk about tonight, zero harm. Should you have something like zero harm in your mission statement, your goals, or not? You can go to conferences and listen to academic professors talk about these sorts of things, literally for hours, but they're not the ones who actually have to make the decisions. So the folks that we have here tonight are exactly those sort of people. But we started this series with complacency and COVID. It's not over till it's over. And I think we'd all agree it's not over yet. So before we get into zero harm, I was going to ask each of the panelists just to give us a brief update on how things are going with COVID in their area or with their company. Not too long, but we are dealing with a crisis. And then we're going to move into tonight's topic, or today's topic in India, zero harm. But we started with complacency and COVID. The next one was that we did 2 weeks ago was on leading indicators. What would make you change? And although there were hundreds and hundreds of folks that actually attended, if you weren't attending, very interesting. We all believe in leading indicators, and we've all got some fairly reliable data in terms of as the leading indicators were going up, incidents, injuries were coming down, and that was really quite reliable. Nobody had a problem with that. We didn't have any instances though where if the leading indicators were going down, somebody had gone into a boardroom with some spreadsheets and some PowerPoint slide graphs and got the company to make a significant change, or what we would use corporate speak, a pivot. So before we get into tonight's new topic, just wanted to throw that out to the audience. Do any of you actually have an example you could send in to us where you did get the company to make a significant change or a pivot just based on numbers and graphs? I'm not talking about the example Dr. Wada had where he went out, the scaffolding was attached to the building with a rope and he stopped the job and got it secured properly. I think we've all done lots of that. This was much more, spreadsheets, PowerPoints, boardroom type of thing. All right, Hector, you joined us. Anyhow, we had a great time the last webinar, and I'm certainly looking forward to this one. And I'm also sort of glad it's a difficult decision, zero harm. So let me introduce you to the people who actually have to make these decisions, if you will. Dr. Pravina Dorothy is with JLL, Jones Lang LaSalle. She is the EHS manager for West Asia, and her office is in Bangalore. And I've had the pleasure of actually presenting to Dr. Pravina and the folks at her office there, and just a wonderful group of folks as well. We also have Hector, and Hector, I'm not sure if I'm going to get your last name pronounced correctly or not after all of these years. Salazar?
Exactly, you're right.
Okay, well, I should know it. I've known Hector for over 20 years, ladies and gentlemen. Originally, he's from Venezuela. Worked with the company Shaw Breadrow Price in North America. Was a Canadian while living in Ottawa, but I worked with Hector years and years ago and ran into him. We were both on an expert panel in at the Gale conference, Gas Association India Limited conference in in New Delhi. So Hector, thanks very much. And Hector's had me up to his refinery in Bhatindra, and quite an operation. I think you find quite interesting what's been going on with COVID there. I would also like to introduce Mr. Shobit Tiwari. Now, Mr. Shobit is from Karen Energy in Delhi. I've been to his office. Mr. Santosh was with us 2 weeks ago there. And Karen Energy is committed to zero harm, everybody, and very happy to have you on the show, Mr. Shobit. Thank you very much for coming with us. And Mr. Aravind is from the Mahindra Group, and Mr. Aravind, thank you again very much for taking the time. Now, I don't really need to introduce the Mahindra Group to people in India. But many different groups, and so very interesting to hear their approach, if you will, to zero harm. And the last panelist I'd like to introduce you to, everybody, is Shikhar Dhangra, and now he is the CEO of Diva Communications, which includes, among other things, industrial safety review. I haven't, Shikhar, put the cover up on the wall yet behind me here. I'm on the cover of his magazine this month, and I just thought it would be just a little too tacky to put it up behind me here, but I'm going to get it up in my office very soon. But most of the CEOs of media companies that I've met over the years are CEOs of media companies. They know very little about health and safety. And Mr. Shikhar came to the hotel where I was speaking at a Tata conclave in Mumbai, just in the beginning of February, I believe. And he interviewed me there, and I was just really surprised at how much he knew about health and safety. So I asked him if he could come and be on the show just to represent the general group of, like, their database is 500,000 people, ladies and gentlemen. So I'm not saying he knows what's going on at every company in India, but he'll hopefully be able to give us a bit of perspective of what's happening over there, sort of in general with companies. Anyhow, let me start with Dr. Pravina, if I can. Dr. Pravina, just a bit about how's COVID going in Bangalore, and if you could maybe tell everybody just a bit about what JLL does, because like we've talked about before, you've got a fair number of training challenges with something like COVID and your workforce. So how's it going in Bangalore, and then how's it going in the 30 territories where you folks operate?
Thank you, Larry. Thanks for this opportunity. So in Bangalore, I'll start with Bangalore. So Bangalore, the numbers are increasing in general, and we have gone back to lockdown since yesterday. So till next Tuesday, we will be under lockdown. And the numbers in general have been increasing mainly because of the number of testings which we were doing has increased. The government has increased the number of testings. Anyone who is even traveling from district to district, as I traveled last week from Bangalore to my hometown in Tirunelveli. So the moment I landed, I was tested at the airport immediately. And even while I had to drive down to my district. So even while I was crossing the district border, I was stopped, and everyone who's crossing stopped and are asked to test. So the testing has definitely improved, increased, I would put it. And this had also led to the number of cases, increase in number of cases. But going back to lockdown and creating containment zone, already Bangalore had almost 10 plus containment zones, and they are further evaluating and starting to contain further more zones depending upon the testing, test reports, results, and all. So that is about the Bangalore. Okay. Now about JLL. JLL is a global real estate services company which focuses on investment and real estate management services. And we have presence in over 80 countries. And in India, as you said, we have presence in over 30 states and union territories. And we have almost about 12,000 employees. As you rightly pointed out, most of our employees, like 90% and above, are actually working with at the client sites. You also have visited one of those. So that itself poses a challenge. Like we are not all of us are not under one roof, like in JLL offices and all. So that itself posed us challenge to reach out. And since we started earlier, like since we are a global company, we had visibility of what is happening in China, what our sites are, JLL offices are doing in China. So we started as early as January end. So the first HSSC alert went to our region was on 25th of Jan, actually. And then within a couple of days, we came to know that most of us haven't even opened the mail, what exactly it is. So we started running sessions, and our leaders came together, and emergency response team was formed. And most importantly, we created a JLL command center. So it became a nodal point for all the 12,000 employees or all the accounts. We have almost 150 plus accounts to reach out. It is a single point of contact where JLL employee can call and discuss about any issues related to COVID, and they will be guided through the processes and procedures. And as well as any COVID suspected cases are there or close contacts needs to be tracked, everything is being done centrally. And this actually has increased our distress support to 90+% survey, which we conducted recently.
Okay. Did you remember the last time you were mentioning you had the app for the unsafe acts, and somebody was asking if you'd modified that to include some COVID stuff? Have you done that since the last time?
So it was Don't Walk by app. I think you are referring to Don't Walk by app. So we have another application, that is the JLL EHS induction application, where we added one more point as JLL self-health declaration application. So it was added in another application, not exactly in the Don't Walk by app.
Okay. All right. Perfect. Okay. Excellent. And so far, so good in terms of most of your workforce. Things are like not out of control. Everybody's.
Yes, absolutely. That is the reason we got more than 90% in the distress support, actually.
Okay. Well, thank you very much. Okay. Well, thanks very much, Dr. Pravina. Okay, Mr. Shobit, what about, well, I'm not sure all where Cairn Energy operates. I think you were saying East Coast, West Coast, your office is in Delhi, and you were saying you're at home because your area is locked down. But how's it going with the operations on the East Coast and the West Coast?
Okay, so good morning to all. And COVID, a pandemic, all of us are aware that even the kid going to school to a 90 years old, everybody know about what is COVID. And as far as, so first I will take this opportunity to say that I work for Cairn India, which is a vertical of the Vedanta. So Cairn Energy was the past. Now we are Cairn Oil and Gas, a Vedanta company. With that, we have operation in East Coast, which is called Rava, on the West Coast, and in the western part of India. And coming back to how we have done regarding the operations to have the continuity, first thing we did was to have an operation continuity plan. And when we prepared that, the thing which came out, three things. Number one, in case of COVID, how you will do the delegation of authority. So we have defined up to third level how the delegation of authority will change in case the COVID occurs. Number two, we were aware that social distancing is going to play a big part in this. So what we did, we have identified the people who were critical for the operations, the people who are critical for the business, and the enabling people to continue the business. Requested all the enabling people to work from home. And that created the required space within itself. The third thing was to ensure that it is not only the staff and employee, but also their family remain safe. So we have connected with an hospital and took the call on doctor facility. So that facility we have extended to all our staff, wherein for the mild ailment, nobody needs to go to the hospital. It has served two purposes. Number two, it will not strain the medical industry, which is already under the tremendous pressure because of the COVID. And also it will not expose the employees and their families to go to the hospital and expose them for an infection. So we took the doctor on call facility, wherein anything happens, you call doctor and they listen to you, they give you prescription, what is required, prescription comes on the mobile, then you can connect with the medical store, the medicine will be given to the place. For the site people.
Cool, very cool, very cool, very cool.
For the site, which is a remote area, we created in telemedicine facility, wherein we have the doctor from a big group of hospital, and they connect with the specialist. So there is digital telescope. They hear what is happening. Somebody is hearing that in Chennai, a specialist. So basically, you are connecting to the specialist, and there is no need to go anywhere. So we look at that, how we can facilitate our staff, their family, to make them comfortable. Ask people to work from home. Only 30 to 33% people are required to come to the office, and then create a succession plan so that the business continuity is there. Thank you.
No, that was very good, and it makes a lot of sense as well too, right? I mean, one wonders why a lot more of the equivalent of FaceTime with your doctor for a lot of basic things hasn't really taken place yet, but hopefully some of that, because for a lot of things, you don't really want to go to the hospital or the doctor. You're more risk going there than you're not all that sick, and there's usually sick people in the doctor's office, right? Anyhow, thank you. Mr. Aravind, tell us a bit about what's happening all over Mahindra Group, I guess. That's, oops, I'm supposed to sort. I went out to turn Hector. Are you? Oh no, let me go back to Mr. Aravind because Hector's gone. How does Mahindra? How are you guys dealing with? I mean, you've got 36,000 employees or something like that, as I last checked. So that's an awfully big group of folks to be managing something like COVID with across India. How's it going?
Good morning, all. Thank you, Larry, for the opportunity. And when it comes to, let me brief about the conditions in Mumbai and then the Maharashtra. We contribute about 30% of the India's numbers. So we are roughly around 2.5 corona cases in Maharashtra. So it's a very hot zone here, and our business, majority of the business is around Maharashtra. And when it comes to Mahindra Group, we operate in 11 sectors, and then we have 150 companies, registered companies, and then we operate around 100 plus countries. It's a very huge group, and the manpower is somewhere, when we include TechM and then the other Mahindra Finance, we are somewhere around 1.5 employees, 1.5 lakh employees. So it's a quite big group, and So the kind of support or kind of initiatives which we have taken to prevent our employees from corona is our leadership is very committed, and the one which we believe in is actually to support their families, and we are very much sure that actually our major strength is our employees. So we are showing all we could do for all our stakeholders, including our vendors as well. We are often connecting with our vendors, supporting them in various initiatives.
Very
So,
good. Very good.
the
Excellent.
post-pandemic, what has happened is actually the leadership connectors drastically increased. Actually, for example, if you could see, we often now have a lot of interactions with our. We have an opportunity to interact with our MDs and CEOs, wherein this online platform has helped us. So this particular platform has. This is actually to keep the morale up, and then to care for the employee. This is one which we have initiated. On the COVID front, actually, if you look at, actually, we have developed a 15-point element, and then we have deployed across our sites, right from the management commitment to identification of the SPOCs, and then we have defined all the control measures and everything, and we have asked our people to integrate into the normal way of life, normal working. We said actually this is going to be the new normal, and then this you need to integrate. So with having said that,
have your employees, like, that's a lot of people to get to accept all of that. Have you got most of them sort of, I mean, it is reality, right? They do all have to do this, but you know, I live in Canada, and south of the border, you got to see what happened with reality. You know, people didn't take it seriously, and there's an awful lot of people sick now, right? So, have you guys managed? Do you think you've managed to keep everything under control within your own workforce pretty well then?
yeah, see, here actually we are engaging. We are giving a lot of confidence to our employees. The workplace is ensuring that actually it is safer. In fact, actually, you'll be surprised. Actually, our construction sites are slowly getting back, because India had a lot of migratory workers, and then they were moving out. So that was an issue, but they are getting back, and with a lot of the kind of confidence Mahindra has given to its workforce. And our holiday resorts has ensured kind of an assurance program for its memberships, and we have the business has started moving in. So if you look at actually the care point of view, we had every location we have identified and tied up with our nearby hospitals. Especially in Mumbai, actually we have for Mahindra employees plus its families, we have identified an 100-bed hospital for quarantine, and we also have tied up with a Nightingale. It's one of the arm of Mahindra. So we support our employees and their family on their home quarantines as well, and we have an counseling by the doctors, and then we have various newsletters and a lot of awareness which is being circulated on a daily basis. As you said, actually, you were saying, actually, are they following it? Actually, yes, we are. So far, actually, we were able to achieve this. We also, to be practical, actually, there used to be some reluctance. Wherever the reluctance were there, we are trying to address those reluctance among the employees and getting back to the track. So that's how we are handling the COVID, and we are very much committed leadership, and then we are working on it.
Good for you. Well, certainly one of the, I don't know, I don't want to say consensus findings, because there's only 4 expert panelists on the panel in North America, but that big corporations, that are good with the H&S, with health and safety, are really going to have to take the lead here, more so than government. That they're going to have a lot of positive influence, and certainly some of those, you know, some of the companies like Procter and Gamble, I think are stepping up as well too, and recognizing that they've got to help out in the community as well, right? Not just with their own folks, and also about the 24/7. Shikar, I don't know. Hector seems his signal. I know he's up in Batindra there, so I'm not sure how strong his signal is. But when I was talking to you before, you were saying at first companies, people in India were really quite scared. There, excuse me, not panic, but close to it. Have things settled in general? Have things settled down? And approximately what percentage of companies are operating?
Yeah, I would say till now, as per the information among the media, it's almost 20 to 30%. Things are on, because, of course, the metro cities where things have been affected, and where there are some plant areas which are maybe in orange zone or maybe green zone, that are given some leverage in operations. Okay, but in terms of production side, what I was talking to a lot of manufacturers yesterday, and they were telling me things have been produced, but due to logistics issues, we could not able to deliver those things, and cycles have been, get stuck. So that's how people are facing. They are waiting for things to streamline. The major transports like a train and even the kind of cargoes, if that goes smooth, I think will come back to normal soon.
Okay, yeah, well, I didn't think about that, but like you were saying, Dr. Pravina, you had to go through almost 3 checks just to get home to visit your family. So, the speed with which goods can go moving around the country has probably slowed down considerably as well too. And then there was just certain things that they were worried about, like printing and things. I remember, they didn't want to make sure I had books left, right? Because we didn't know if we could get more printed right away. So, be careful who you're giving them away to right now. So there was a lot of logistics. I wouldn't have thought about that, Shikar, about the logistics. Well, look, I'm not sure if Hector's going to make it back, but I do know, ladies and gentlemen, just talking with him prior to the show, 18,000 people on site at the refinery. They lost about 4,000 of them as soon as the crisis hit, where people wanted to go back to their, a lot of the migrant, contract workers wanted to get back to their families wherever they'd come from, different parts of India. So they didn't shut down, but they lost about 4,000 folks. But now they're pretty much, back in operation, and they're doing very well in terms of the number of cases they've had. I can't remember how many, if any, but I just remember them saying, it's been really very good here. So, guys, thank you first of all very much for the update on that. And I know everybody maybe is, we're all kind of tired of hearing about COVID, but it isn't over yet. And I thought you might all like a bit of an update in terms of what's happening, and also maybe some ideas you can take with you. So, moving over to zero harm, Dr. Pravina, does JLL have zero harm as part of its mission statement goals, and why or why not? I don't want to say in your opinion, because you're sort of representing JLL here, and you may not have made the sole decision yourself, but maybe a bit of background on the policy that you have and why.
So JLL being a global company, so we have a global health and safety policy, and being signatory to UN Global Compact, we do publish annual reports on health and safety, which is available in the public domain for all. So from harm perspective, our focus is prevention of harm rather than, I would put it, zero harm. So having said that, it is not like in our global HSSE KPIs, we have global HSSE KPIs for all of the sites or accounts which are there across globe, and it is the same KPIs across all. There won't be any deviation for, and it starts with the incident. And of course, we do have the leading indicator. Since we are talking about the harm, I would like to focus on the incident. So in incident reporting also, the first thing what we have is zero target for fatality and life-changing incident. So that is, even though we don't claim to be zero harm as such in our policies and procedure statements, but our KPI, the first KPI itself is about zero fatality and life-changing incidents. And the reason, since you asked why, I told you like 90% of our team members are spread across under in different client spaces and in different geographies. The moment we bring in zero harm, we, as of now, we are encouraging people to report incidents. So that itself is a major challenge which we are working on. So we need to ensure that people are comfortable and confident enough to report incidents as much as minor, like a first aid, cut on a thumb or something like that. So this is what we are working on as such, to build confidence and people coming out and reporting incidents. Of course, we are working on the lessons learned and trying to ensure that it is not recurrent. And the leading indicators which we are using for that is, of course, the don't walk by app, which I was referring to, where an unsafe condition or unsafe act is immediately recorded. And we have auditing structure in place, which is done through CMO. CMO audits happen, EHS audits happen, and we have a business assurance dashboard, which actually projects these audit scores to the top management, not only to the account team, but to the top management as well. So as of now, our focus is prevention of harm rather than, would say, zero harm.
No, but I like it, and I also think it's interesting as well too, though, that the real standard that you have is zero serious injuries and fatalities, right? Basically, is what your standard is.
Yes.
And I like that. And yet the idea that you see the negative part, or the counter argument to zero harm, is that you'll never achieve it and you get people discouraged because you've got unattainable goals. And I'm not going to say yay or nay on any of it. That's why you folks are here. You get to make the difficult decisions. But I like the idea that where the rubber meets the road, serious injuries and fatalities, the KPI is zero. I thought that was very illuminating. Okay, so let me move on. And I really don't know if we're going to get Hector back or not again. So, Mr. Shobit, I know that zero harm is very, like, if you're very big in terms of care and energy. So when was it 2014 that it started? I'm not sure, but I think that's what you said. So tell us a bit about that, and then tell us how it's been going with your workforce since then.
Okay. In Kane Oil and Gas, Vedanta, we adopted zero harm in 2014. What we realized that zero harm is the starting point for the HSE, not the goal. And it has three pillars. The pillar number one, engineering is to be used to out all the hazards. That is number one. Number two, you have to have physically fit and mentally strong people. And number three, you have to moderate the risk appetite of the people. Most of the company work on number one, but number two and number three are also a pillar of the zero harm. So for two, we have ensured that we provide the best possible medical assistance to our people, and we have got it through making mandatory that everybody has to go for the annual medical checkup after the age of 35, and then we see the trend. Any ailment which comes, people are being helped to identify, that is identified, and what are the corrective measures. So we start monitoring people beyond 35 years of age every year, and before that every third year. That allows us that our people are fit to work. And the third thing regarding the appetite or moderate the risk appetite of the people, that is the most difficult part, because it creates a culture. And what we realize that whatever you do, until people get connected with the ground force and let them know that what is our, why we have a concern for them, what we can do best, and that is that when you go and connect to the people on the field, they realize that what are the difficulties, what we can do as a management to bring the best possible work conditions or the safety at work. So we have said that visible felt leadership is essential for all the leaders, and we have put that in their KPI. We have also automated
Don't go too far on that. That's the subject of the next webinar, the felt leadership. So don't carry on too much with that. But the three pillars for zero harm that you have, the first was the engineering. The second one was the medical, whatever, treatment facilities for the people. And then the third thing was I mean, you could maybe word it differently, but if you're going right between the eyes, to curb the risk appetite of the people, that's a heck of a thing to take on. And I think it's two sides of the coin. One of them is the decisions, and also one of them is the skills as well too, right? I mean, nobody's ever trying to stand up and bang their head or slip and fall, but lots of people don't use all the safeguards or procedures that they're provided with. So it's a challenge in places, in places where, the outside culture, you don't see a lot of safety adherence or personal protective equipment, or, so when you're trying to get a concept like zero harm across in Europe, that's one thing. Trying to get a concept like zero harm across in Indonesia or in the Philippines or in India, it's a bit more of a challenge, I would think, right? But you've also got the fact that the people in India are great. They don't have this, I'm entitled to zero harm, and if I get hurt, there's somebody to sue like there is in the United States. I mean, we've got a different kind of attitudinal problem there, where the people don't think they have any responsibilities in term. Yeah, zero harm, but don't make me do anything for it, right? Would be a very much a North American attitude at a lot of places, where I think you get more cooperation from your folks in India if they believe that your leadership group's sincere. I got a text from Hunter Shakar saying that it was pretty brief. It just said no Hector. So I'm not sure if Hector's going to make it back on camera with us or not. But let me move on to Mr. Aravind. Mr. Aravind, what about you guys in zero harm? Are there some divisions or companies at the Mahindra Group that have zero harm as part of their mission statement, and others that don't, or is it uniform across the board? Uh-oh. Mr. Aravind, can you hear us?
Mute, actually, sorry. When it comes to Mahindra Group, we have it's a federation structure, and we have to bind everybody together. We have a group safety council. This group safety council, we meet once in a quarter and then discuss about the safety, the progress of each businesses. This is a very senior level and apex level meeting wherein all senior leaders are part of it. And this particular council is being headed by a very senior leader and to guide the entire group. So we around 2018, we decided to have a zero harm. That is actually, we call it as a vision zero by 2024. We decided that at the group level, and we would achieve a zero harm by 2024. So basically, when I say this, actually, I know that actually this is a very lot of debatable topic actually, and why we did this is there is a reason behind it. So it's all binded with the culture over here in India. It's I would take up an analogy for this. When you say actually kind of when you say everybody knows actually we should not get harm. That's I agree with you on this statement. Nobody is willfully doing any kind of accident or something. So when I say this, actually we felt actually there should be everybody knows it, but everybody misses it somewhere. So to connect everybody, we felt actually there should be one liner, which is a vision statement, which will make the people to follow their procedures and then align themselves to the procedures. So we see it in that point of angle that actually once a statement is set, we focus very much on the process level. We have an annual assessment for all the businesses, wherein we focus on 25 process parameters, safety process parameters, and then about 8 result parameters, which is given equal weightage. So we focus, we see that actually the people are pushed to take efforts on this to achieve that. So ultimately, if you look at actually, we are looking at reduction of injuries. We are people should stay focused on their excellence journey. That's what the entire idea behind the zero harm. That's in Mahindra.
Well, I like it, especially with that many people. The idea that look, we're going to get all of these folks, you know, with some difficult cultural challenges, if you will, aligned around a goal. I think zero is the only one you could probably do that with, really. I mean, I wouldn't be, you know, recommending that you have a 10 over here and a 5 over here and a 3 over, you know, I think if you want to get everybody together, it's got to be one goal, and I can't imagine it being different than zero. Although I guess the real intent is, you know, is the real intent behind everything, like what you were saying, Dr. Pravina, that, you know, the real intent is zero where it really matters. And if people sincerely believe in that, then you've got a very meaningful goal. I think, you know, you achieved it did for you what it was hoping to do. But that's just my guess. So let me move on to all of you again now. From is it working? You know, do you think that the way your wording of the mission statement and the people behind it is it working for you? I mean, and are your workers pretty much there, you know, in terms of, you know, they believe you. So what would you say, Dr. Pravina? I mean, I've been to your place, so I know they buy in there. I mean, I know like you guys have got a great culture there, and you know, positive and all the rest of it there. But that's the only one location. You're all over the place, right? So what would you say? Is it working for you?
So it is working. So the way we had delineated our mission statements and global HSSC KPI, so we have taken into consideration all aspects of like our employees are not under a single roof. They are scattered around in client locations and reach out. How are we going to reach out? So everything has been taken into account. And this is evident. The first KPI which I was talking about, like zero target towards fatality and life-changing incidents, injuries, basically. So we did achieve that. We did achieve. In that aspect, we are working towards it. And as Arvind was saying, like 2024, they are targeting to go zero harm totally. So we don't put it in words that it is like zero harm. Ultimately, all health and safety officials or experts' dream is to get zero harm. So
Yeah.
it is always work in progress. That's what I would put it.
Okay, well, and I'd say from what I saw, it's working in progress, or it is working for you. Mr. Shikar, I mean, I don't expect you to know, like, every company in India and what their mission statement is, but what percentage, if you had to throw a ballpark percentage out there, would 10% of the companies in India have zero harm as part of their mission statement? Would it be as high as 20%, or would it be, you think it would be lower than that? I only usually get to work with the very best companies, right? Because our stuff is beyond legal compliance. You don't have to do SafeStart unless you want to reduce injuries, right? So we don't tend to work with the companies that, are close to getting shut down. But what about the, the majority of the good companies in India in terms of health and safety? Would they have zero harm as part of their mission statement?
Yeah, I was interacting with a lot of corporates and mid-sized companies as in media. I have, I will percentage it as 20% adoption is there. And still people are, last few years, I'm seeing a lot of awareness about their human safety. And they are doing a lot of safety awareness programs and for their human assets, which I always insist them to, what are the things they are doing for those. I would example as like even companies like Siemens or Mahindra or JLL and Showbiz company, I would rate it as in zero harm is a culture that needs to be adopted, and these companies have imbibed this particular values among the employees in their mission statement. It's the responsibility of management who should envision the zero harm culture into employees and their way of working and workplaces. In turn, there is one reaction should be like the employee attitude. It matters. The employees also should take it as if it is for them, rather than these are enforcement by management, because it matters to their lives and it matters to their health. So that's how employees
Yeah,
take it serious.
I
This is what
wouldn't have.
and people are.
Sorry, go ahead. I just was wondering if I missed the part about what percentage do you think that would have zero harm in their mission statement? Just your best
Almost
guess. Just your best guess.
20%.
30%?
Yeah, it's
Okay.
no, it's too high. I believe it's 20% companies who have been taken a zero arms. Even the private companies have been taken. 80% miles go. They have to start, and they are doing it right now. All this. So as I mentioned, it's a culture that needs to be understood. Second, it's a responsibility of management. Third, it is an employee attitude, and of course, that. See, the major occupational accidents are happening because of the flaws in workplace designs and inadequate resources. That needs to be provided by the management and that needs to be engaged by the workers, to adopt this culture of, zero harm in their
Yeah,
lives. Over to you,
excellent.
Larry.
Excellent. Well, I mean, more and more. I mean, like certainly when I first came to India, it was 2008, and talking about zero harm in 2008 probably would have been a bit much maybe back then to be floating that around. Let me ask you, Mr. Shobin, at your facilities, is it working for you? Do you think that the zero harm has it sunk into all of the people at Cairn Energy?
So again, I said that, as I was telling, I couldn't complete what I wanted to say, that zero harm is the start of the journey in the HSE. So when we talked about the moderating the risk appetite of the people, the most important thing was this was the challenge in that, number one, encourage people to report near miss. That is the first and foremost thing which we thought that is required, and people are now believing in that. Reporting the near miss, reporting near miss is the most important thing which can correct the trend. And the other challenge, so first was trust. We like to listen the near miss, and we'll work on that to correct the condition. So that trust and team building was required. And number two, the wrong identification or solution for the hazards.
Okay.
Technically, if you can find out the correct hazard and the right barrier, the problem is less. But what we have seen, that people are not able to look at the hazard because they are not trained. So when we talk about the zero harm, it is the people who are in the field, because HSE personnel maybe 5 to 6% of the company strength, but the people who are in the field, they should be able to identify and take the risk-based decision. And therefore we said that training in that area, train people in that area is very important, and that's what we did to trying to reach to our starting point, that we want to be at the zero harm. So how we are doing it technically, that is more important. We see that all people are working around that. We are seeing that near miss reporting is good. We are able to train people to identify the risk, the people who are on the ground. And the third thing is, and that is probably the most important, is people's perception of the management, to see how management stands or here to have the risk. So we keep on, and we are now again planning a survey wherein we want to hear that how ground people, they feel that the management is the management serious? Are they doing enough? So we want to have a very open feedback so that we do the course correction from time to time.
Well, I really like the idea, certainly too. Like, I don't know how, if you don't have zero harm, I don't know how you introduce the barriers. And if you introduce the barriers, then people can see, that we need to have a barrier between the person, the error and the hazard. And if we can't, then we need another kind of barrier there. I'm not trying to flog my critical error reduction techniques, but things like stairways have got as much engineering as they're ever going to have, right? So in some cases, that additional barrier is arming the person with some additional technology. But if you don't have zero harm as your goal, you can back it up with the barriers, and then everybody can see it, and you can kind of make it a little more systematic for everybody. So when they say, why do I have to do this? You can say, well, because you see, you don't have a barrier here. and we need to have at least one barrier, or for this hazard, 2 barriers, right? And so I think to get people to sort of accept the mapping out of the barriers, the bow ties, you know, and the like being very systematic about the risk, it'd be more difficult if you didn't have zero harm. I think that they kind of go together. They go together that way. What would you say, Mr. Aravind? I mean, you guys are all over this as well too, right? You've got sort of risk mitigation all over your facilities and things like that, where you're doing this with your people. Have you found that the zero harm also helped get the safety management part better, not just the people part better? Or I meant more the engineering, more the engine side of things. Did it also help you with that?
See, the basic idea of having this vision statement is to improve our management system. When I say management system, it's the basic processes which we have identified. So it is really helping us actually. For example, the people are aligned to our goal, and we have actually we have also have in our management process actually we call it as the Mahindra safety way. We have defined actually 10 stages. For example, a good company would be the higher stage, that is 10 is best and the least is 1. So annually, actually, we rate the companies like the way the financial risk management companies do for any buddy. So we do rate our companies are within our group. Actually, we rate them and then say you are in stage 1, stage 2, stage 3, whatever it be. And the kind of why this is they are aspiring to move up in the ladder actually on every year basis. So why they do it is actually we say actually if you move to a higher stage, actually that you can really dream of about having a zero harm culture. So so that's why actually our vision statement is connected to improving our basics. So we have in the group actually we have a company which is at very high level, and we have toddlers as well. So we make sure that actually the toddlers are being given a support environment, and then we help them to grow in their space, and then we bring them up in the stages. So that's where actually this entire vision statement helps us.
Okay. How many how many contract employees typically would you be working with on a yearly basis, Mr. Aravind?
See, we have acquired actually it is business. If you look at actually it business to business, actually we have a quite good number of contracts, maybe of 40% of our workforce could be. When I say the employees, we include our contractors as well. We don't separate them out. We call them as a partners, and so it's inclusiveness actually. We whatever is applicable for employees is as good as for the contractors as well. And we have got a contractor safety management in place. And I agree on that. Actually, India is really not mature to that the global level on various aspects. So but actually, however, we have taken steps forward, and we are working with the contractors to bring their level up. So we believe in our own contractors. We have started their pre-qualifications, and we have never rejected any contractors. We said actually we will give you time, we will work with you, and then we will bring you up to our expectations. We don't want you to walk out and then bring in a new guy who's absolutely new to the environment. That we don't want to happen. So we decided to work with them and then bring their level up. The same is happening with our suppliers as well.
Excellent. So instead of trying to make them accept a paradigm of zero harm right off the bat, which might just be like, you know, way too big a step, you just take them a bit at a time, and as they move along, they can see, well, yeah, really, none of this has to happen. Like, none of it. Like, it could all be eliminated. And that I don't think you'd be very successful trying to go, like the expression here is to go from 0 to 60 in 5 seconds like that, you wouldn't make it, right? You know, but
Maybe we don't make
if,
it.
if you
That's
took them-
very.
yeah,
It's a very gradual step. It's a very gradual step to change over a stage. Actually, it takes for any organization about 3 years or something. It is a very they struggle a lot to achieve the next stage.
okay, yeah. Dr. Pravina, how long did it take? I mean, for the workforce to believe in the, you know, I know you don't have exactly zero harm, but you know, they're pretty committed to an injury-free, incident-free workplace. And we're also getting some questions in for you again, Dr. Pravina, but I think everybody thinks you have a magic app, so you're probably going to have to tell them that it's the people that use the app that make it work. But they wanted to know again, are there any COVID application used and also in prevention of harm in JLL? Like again, I think they're hoping you have a magic app, so we can come back and tell them that there really aren't very many of those around. It's the people who use the app that make it all work. But how long did it take at JLL for you to achieve what I would say a real that culture is real there, like, you know, the people believe, right? How long did it take? 5 years or?
So, Arvind touched upon a point of Global Safety Week and all. So, our last year we completed 7th year of Global Safety Week actually. So, our culture started well before. We became a signatory of UN Global Compact in the year 2009. So that is when actually our top leadership, CEO level, and they started formulating the mission statements and all came into picture. And in the past 7 years, it took us enormous amount and work through the processes, procedure, the apps, magical apps, which you are talking about. That actually an award-winning app, which so we review what are the necessities. Even though I say prevention of harm, there is a lot of work which goes under that, not only the KPIs. So I'll just briefly touch upon, since the question came in, because there are many more apart from the don't walk by app. So when an employee joins JLL employee, the first thing they undergo is the employee self-risk review. So they have a first, whether they are from finance or supply chain management or front office executives. So it is a system of assessing the employee's job profile against the risk they are going to be exposed. And we do have an application, CMO application, so through which we review, and it is an automated system, wherein if I'm working with a work at height, my work involves work at height, immediately it will lead to that I need to complete all these forms, and then I need to finish up my training, specialized trainings and all. So that is the first step with respect to employee. The second is about the training. Training is an important aspect. Last year, we had different modes of training. One is online training, in-person training. And last year, we introduced a new form of training, that is mobile-based training. So we understood not many people are willing to go back and again get trained. If there is some doubt, they are not willing to go back and train on a system basis. So we just made a in partnership with a Better Place team. So we made a chatbot based training app. It is very fun app actually. We tested and it was a success also. So that one, actually last year we won the Confederation of Indian Industries Award for Best Digital Practices in EHS. And related to COVID.
Good, no, good for you. Sorry, that's all. I didn't mean to interrupt. I just.
And apart from that, we the reporting perspective, like don't walk by come into place when there is a reporting requirement from unsafe act, unsafe condition, I can just take a picture and then send it across, submit it, and it will go and hit the relevant persons, even to the level of account manager it will go. And we have incident reporting, and in the same tool, we have the good catch and near miss reporting as well, which also reaches to the level of CEO, depending upon the type of incident, near misses, category, severity it is reported. So that is another tool which we are using. And related to work, initially we were with the paper-based permit to work system, which we transformed to electronic-based permit to work system, because we understood that it takes time to review, and paper from one table, when it goes to the another table, it is taking time, and last minute people are signing up. Rather than that, we wanted to track actually how efficiently time can be managed, in terms of, even if you are sending me an permit to work request for even confined spaces 24 hours before it needs to be sent, and what are the things which are being done, whether aeration happened or not. So there is a continual process of follow-up in that also. That is also an online tool which was very much appreciated by our clients actually. And after that,
I'm gonna just tell the person who asked the question just one more time again. The things like this will work if you get your workforce to use them, right? Then that requires that there's a trust factor, and it also requires that there's follow-up, or else what's the use, right? And so, to a certain extent, you guys earned the right with your culture to take advantage of the efficiency that the technology provides, without having to worry about all of the negative stuff that a lot of people, people taking pictures and ratting other people out about unsafe acts and all kinds. You can come up with a lot of reasons to not get involved in your company's health and safety program if you want to. And I think the challenge for all of us as we try to get to zero harm is that you actually have to get every person involved. Our manager saying this to me once about zero harm, and he said, Larry, you get 50% of your people doing things better, you're going to get a 50% improvement in production or a 50% improvement in quality. But if you want to get to zero harm, you have to reach 100% of your people, not 90. You reach 90 with production, you're going to get a 90% improvement. That's pretty good. But to get to zero harm, you have to reach 100% of the people, and that's a challenge. That's a challenge that only so many companies are willing to undertake. But I think what everybody got to hear listening to you folks is that if you take the challenge, the benefits that you get go beyond just the zero, like the three pillars, for instance, is really excellent. And to be able to get a company with, I think a lax, I believe, is 100,000. So 1.5 is 150,000 people. Is that correct, Arvind? Mr. Arvind?
Yeah, you're right.
Getting that many people to come together. I can't imagine doing it without a goal of zero harm. But then again, I kind of like yours, Dr. Pravina, about the, look, we've got the real goal in their head, which is nobody dies, nobody gets maimed and seriously, tweaked up so that they're not going to live their life right. And you believe in that, that's pretty good. I think that's what we all really, deep down. Somebody sprains an ankle, it's not the end of the world. I've sprained them playing basketball, you'll get over it. But there are other ones where you don't get over it, and I think that's the ones that we all want to get. We all want to get to zero. I don't know if we got time for one more question here. Mr. Shekar, anything you'd like to add in terms maybe just of what you see the trend of industry in India? Like, if I was to ask you this question next year, the percentage of good companies in India that have zero harm as part of their mission statement, do you think that's likely going to be going up to 25% or 30% a year from now? I mean, provided we ever get over COVID, that is.
Yes. Yeah,
Okay.
of course. So you're right, Larry. You mentioned it is going to increase, and as I've mentioned in the earlier conversation, that there are a lot of increase of safety awareness. There are various initiatives taken by the management and even the governments talking about road safety, maybe a construction safety or maybe occupational safety. As Pravina was mentioning about celebrating Safety Week, I have seen and I have attended that as a media. There are a lot of public functions where they do conduct seminars, they conduct on-site demos, okay, in the Safety Week kind of thing, which I have seen those factories. And of course, the main part, Larry, if he has to go up, the main is the broad, the laws are restricted to only 3 to 4 segments, like in construction, factories or mines and, ports. It has to, because the major workforce is working for a different, which is apart from those 4 sectors which I have mentioned. The law is applicable right now for those 4 sectors, and that has to be broadened to all the service sectors, all other sectors.
Yeah,
so that will.
I agree. No, I agree, Shikar. You typically find, right, oil and gas, steel, electric power, and some transportations. So like you're saying, but it's general industry, general manufacturing. It definitely needs to be broadened out. We're out of time, everybody. And but I talked to you for hours about all of this, and I really find the discussion interesting, especially as I go around the world. But thank you very much for the time. For those of you attending, 2 weeks from now, we are going to be talking about felt leadership. Are they feeling it? I mean, is the workforce feeling it? It flows, if you will, from tonight's topic of zero harm fairly nicely, in that you're not likely going to have a goal of zero harm unless your leadership group is on board. But we've all experienced a lot of flag waving, and we've all experienced some leaders that are genuinely sincere. And in my career, I've met about 300 or 400 plant managers. The ones that are really sincere almost always had something tragic happen in their career. Almost all of them. So, some of the lessons they learned, they certainly learned the hard way. But I think again, kind of like you were saying, Shikar, things are changing for the better without it all being learning the hard way. So I hope you can all come and attend in 2 weeks when we're talking about felt leadership. I think it's very important. On the other hand, I love my kids. My wife loved our kids, and we couldn't keep them from getting hurt when they were little. So it wasn't because we didn't care enough. So there's obviously some skills involved as well. So thank you very much, everybody. Thank you very much for attending. If for whatever reason you couldn't get on, we will send you a recording with the follow-up email. And I hope you can join us in 2 weeks for the next one on felt leadership. Thank you all very much. Really appreciate it. And thank you for the questions that you sent in as well, too. And there is no magic app, everybody. So don't be asking her for the magic app. She does manage to get her people to use the app, and I think that's where the magic comes from.
Actually, the motto is one team safer together. That is our motto.
All right. Okay. Thank you very much, everybody. We'll see you in 2 weeks. Okay. Bye-bye.
Thank you, Larry. Thank you very much.
Okay. Bye-bye, everybody.
Bye-bye.
Just me.